Busy time coming in our lives as we have a lot of activities, events in our life, and our ability to adjust or to adapt to new events is very important. If you can pass easily this adjustment or adaptation, it's okay. If not, you can become a patient for some psychiatrists with these adjustment disorders. So, what is adjustment disorders? Adjustment disorders are stress related conditions. Patient can experience more stress than would normally be expected in response to a stressful or unexpected events, and the stress causes significant problems in patient relationships, at work or at school. It depends on the age. So work problems, going away to school, any illness, death of a close family member, or any life changes can cause stress. Most of the time, people adjust to such changes within a few months. But if patient have an adjustment disorder, he or she continue to have emotional or behavioral reactions to these events that can contribute to feeling anxious and depressed. So it starts within 3 months of a stressful event and lasts no longer than 6 months after the end of the stressful event, and it's called acute type. However, persistent or chronic adjustment disorders can continue for more than 6 months, and it's called chronic type, especially if stressor is ongoing, such as unemployment. Stressful life events, both positive and negative, may put you at risk of developing an adjustment disorder or adjustment disorders. Positive, even a positive events, of course. For example, your birthday or marriage can be very stressful, even if this is a positive and awaiting event. So, stressful events like divorce or marital problems, relationship or interpersonal problems, changes in situations such as retirement, having a baby, or going away to school, adverse situations such as losing a job, losing or loss of a loved one, or having financial issues, problems in school or at work, if not your problem, of your children, could be life-threatening experiences such as physical assault, combat, or natural disaster. Ongoing stressors such as having a medical illness or living in a crime-ridden neighborhood. And life experience like experienced significant stress in childhood, which have impact in adulthood. Have other mental health problems, have a number of difficult life circumstances happening at the same time. Symptoms. Signs and symptoms depend on the type of adjustment disorder and can vary from person to person. Patient can experience more stress than would normally be expected in response to a stressful event, and the stress causes significant problem in daily life activities. Adjustment disorders affect feeling and thinking about yourself and world, of course. Some examples of symptoms include feeling sad, hopeless, or not enjoying things you used to enjoy, frequent crying, worrying or feeling anxious, nervous, jittery, or stressed out, trouble with sleep, lack of appetite, difficulty with concentration, feeling overwhelmed, difficulty functioning in daily activities, withdrawing from social support, avoiding important things such as going to work or paying bills, and suicidal thoughts or behavioral. So all the symptoms are similar to depressed person. How can we diagnose in a patient or by self these adjustment disorders? So diagnosis of adjustment disorders is based on identification of major life stressors. It's the first thing to do. Symptoms, second one, and how they impact your ability to function. So DSM-5 lists this criteria, like having emotional or behavioral symptoms within 3 months of a specific stressor occurring in your life. At least 3 months or within 3 months of a specific stressor. Experiencing more stress than would normally be expected in response to a stressful life event, and or having stress that causes significant problems in your relationship. And symptoms are not the result of another mental health disorder or part of normal craving. DSM-5 lists 6 different types of adjustment disorders, and each type has unique signs and symptoms. We can count them like with depressed mood, with anxiety, mixed disturbance of conduct, mixed disturbances of emotions and conduct, and unspecified. So with depressed mood, symptoms mainly include feeling sad, tearful, hopeless, and experiencing lack of pleasure. With anxiety, symptoms mainly include nervousness, worrying, difficulty with concentration. Children who have an adjustment disorder with anxiety may strongly fear being separated from their parents and loved ones. Mixed with anxiety, combination of depression and anxiety with disturbance of conduct mainly involve behavioral problems such as fighting or reckless driving. Youth may skip school or vandalize property of someone. With mixed disturbance of emotions and conduct, it's a combination of them, and unspecified symptoms don't fit the other type of adjustment disorders, but often include physical problems, problems with family or friends. And finally, we get treatment. People with adjustment disorders find treatment helpful, and they often need only brief treatment. Others including those with persistent adjustment disorder or ongoing type. Stressors may benefit from longer treatments. So treatment includes psychotherapy and medication or both of them. Psychotherapy is also known as talk therapy and is the main treatment. Provide emotional support, especially from loved one or a family or friends. Help you to back to your normal routine. Learn why stressful event affected you too much or so much, and learn the stress management and coping skills to deal with stressful events. This can be provided as individual therapy, group, or even a family therapy. And the next type of treatment is medication such as antidepressants or anti-anxiety drugs may be added to help with symptoms of depression and anxiety. As with therapy, you may need medications only for a few months, but don't stop taking any medication without talking with your doctor first. If to stop suddenly some medication, you can have withdrawal-like symptoms. Antidepressants, for having some effects, need at least 2 weeks and required to take them for 4 to 6 months for having a good effect. Thank you very much for your watching. Hope this video is useful for you. If this one changed your ability to understand adjustment disorder, you can subscribe and follow it. Have a good time.